Thank you. Thank you so much. I am so thrilled to be here in Nashville. I am from Milwaukee, Wisconsin, and the name of my firm is called Jump at the Sun Consultants. It's based on the African proverb, which says, jump at the sun, you may not reach it, but at least you'll be off the ground. And that's really the philosophy that we use in working in communities. We have a number of objectives today that we're trying to achieve. First of all, we'd like to help you remove some of the jargon that might be in your vocabulary as it relates to talking about social determinants. And then we'd like to give you an opportunity to define your target audience and to narrow that audience. Who are you trying to reach with your messages? And then we want to provide you with an opportunity to identify and apply the 5 C's of effective messaging. And finally, we're going to discuss some strategies and tactics to market your message. So, I'm assuming you don't all know each other, correct? Okay, so we're going to start with one, and this is a very interactive workshop. So what I'd like you to do is, for our first activity, I'd like you to assume maybe you're in an elevator or a dinner party, but you're talking, you're introducing yourself. And introducing yourself, I want you to say your name, your agency, and the type of work you do, who do you work with, and what your mission is. So maybe if you could try to group yourself into maybe groups of 4 or so, and someone in that group needs to keep track of buzzwords, jargon, someone who does not work within the public health arena. Would they understand what you're saying? Okay, so you're going to introduce yourselves as you normally would. So if you could kind of bunch into groups and do that, we'll give you a few minutes to do that. Okay, prevention, helping children, promoting health.
At risk.
At risk.
Financial stability.
Financial stability. Anything else?
Outcomes.
Say that again.
Improving outcomes.
Improving outcomes. Any others?
Payee sources.
Oh, wow. Okay. Okay, so we're going to spend a lot of time talking about vocabulary and how do you craft your message. If you're at a dinner party, you're in the elevator, you only have a short amount of time to speak, but you want to be heard. You want your message to resonate. So actually, I'm going to read something that I came up with real quick. Tell me what you think. Just came up with it. Okay, so I say, hello, my name's Lorraine Lathen, and I work with families who can't afford the basics in life. I work with families who face significant barriers to better health. You know, families whose dreams have been foreclosed on. And my organization, Jump at the Sun, we work to lift everyone up, to give everyone a chance to live a healthy life. Okay? So do you see how that changes the texture? It's not just that I work with women. I work with families. Their dreams have been foreclosed on. Okay, so I'm going to give you this cheat sheet so that you can use it and come up with how you want to introduce yourself in the work that you do. So we have to go deeper than just saying I work with low income, I work with high risk, I work with disadvantaged populations. That's the old vocabulary. We're going to change it up so that people can hear our message and be propelled into action. Okay, does that make sense?
Yeah.
Okay, so just really quickly, definition, social marketing. What is social marketing? What is health promotion? Social marketing basically involves promoting an intangible product. So we're talking about promoting a change in behavior, in attitudes, and beliefs. It's very different from commercial marketing. Commercial marketing is profit-driven. This is about communicating in a way that will lead to social change or a health benefit. So we're trying to get our target audience to either adopt, abandon, or maintain a behavior or an attitude. I'm sure you all know this, but I just want to throw that out there. In terms of developing a message, there's 4 steps. We're going to take you through those 4 steps of message development. The first one is to define the problem, the issue, to be clear that you understand what is going on in your communities. Because the worst thing is to develop a message that doesn't really reflect the realities of that community. The other step that you want to do is you want to make sure what kind of messages do you want to convey that reflect the realities of those communities, as well as looking at perceptions and beliefs from the perspective of people that live in the community. And then this last one are what are some of the competing issues? I'll just give you an example. Again, I'm from Milwaukee, Wisconsin. The media has done a great job of raising awareness on infant mortality. And I was working on a project where we were trying to increase the general public's understanding of how stress has an impact on poor birth outcomes in terms of preterm low birth weight. So our whole issue was stress, and our tagline was, "I deal with stress in ways that don't stress my baby." At the same time, the city health department, their issue, what they gravitated to was safe sleep. If we could only get cribs to these women, we wouldn't have this issue of infant mortality. So there are competing issues and competing philosophies. So you have to be aware of those in your community as you're crafting your message. And it may mean negotiating with the mayor who stands up and gives his speech on safe sleep, getting him to understand how that message does a disservice to what you're trying to achieve in your message, especially when you look at the data and you see that the deaths aren't occurring, they're occurring before the infants even leave the hospital. It's not an issue of give a woman a crib and then we don't have this problem. So one was just to assess your situation. The second step is being clear on what is it that you're trying, what are the objectives of your communication strategy or plan? What are you trying to achieve? And then who can support you in delivering those messages? Okay? Again, support your programmatic objectives. I put this up here because quite often, sometimes we get lost in our work. We start, and our program objective may be breastfeeding, and the next minute we've jumped on the bandwagon over here for someone who's focused maybe on father engagement. Now, there's a role if you can tie breastfeeding into how to engage fathers, but you really want to stay very close to what your objectives are and what your message is. We know that if you develop a consistent message and you deliver it through multiple channels over an extended period of time, it's likely to resonate and people are likely to act on it. But if you keep changing your message, that's a problem. It's like, wait, what is that organization about? Are they breastfeeding? Are they preconception care? What is it? So you want to be consistent with your message. And then you want to identify your target audience. And I go into all kinds of communities and I'll hear, I work with women and children. And that's too broad. You have to really hone in and define. Well, women and children who live in a particular zip code, women who have experienced a poor birth outcome, women, maybe you look at race, maybe you look at SES. There's a number of things. Once you really hone down to your target audience, that's when you start developing the message. If you start developing the message with just women and children, it's too broad and it's not going to reach them because they're not going to see them in it. They're not going to see themselves in it. So we're going to do another activity where I'd like you to start to think about your target audience and audience segments. Okay, you may have a very broad audience, but then within that there's segments and you have to develop a different message for each segment. Does that make sense? And let me know if I'm being too basic here. Okay? No? Okay, so the second exercise that we're going to do, I've got to hand it out, is we want you to define your target audience and then keep all of these things in mind. Who are you trying to reach? Why is this issue important to them? And I will tell you with social determinants in public health now, the audiences that we're trying to reach are much broader. Business sector, it could be transportation, it could be zoning. I mean, our audiences are different. It's not just the impacted population. So give some thought to who you're trying to reach and how you're trying to influence them. And then also, who would deliver that message? Who would be perceived as being credible with that population? Okay, so now we're going to move on. The fourth stage is to actually develop your message and you test it. You test it with your target audience. It's so often people who are designing programs and implementing programs, They will design a message and they will test it amongst themselves. And you look and you say, but you're not the audience. I mean, in terms of this doesn't make sense to me. Yeah, but does it resonate with your target audience? So take the time to, you can do focus group testing, you can do discussion groups, you take it out into the community, whoever. You mentioned churches. Take it to the church. This is what we're thinking about using as a message. We want to test it. And trust them, trust their judgment. For me, and my background is in social marketing, it's difficult when I have to go back to the client to say, I know you developed that message and I know you really love it, but it doesn't resonate with the target population. So you have to get people who are brave enough to accept, okay, let's go back to the drawing board. And in terms of developing your message, you want to provide maybe one compelling piece of data. You want to humanize it, personalize the issue. And then after you kind of lay the groundwork for what the problem is, you definitely have to give solutions. Because you don't want people to sit and feel like helpless. Well, I can't get engaged. You told me all these terrible things about infant mortality, but what is my role? And be very specific. Business sector, faith-based, they all have different roles. Health, they all have different roles. I think of Hamilton County, Cincinnati. They went through a period where they were experiencing one infant death every 3 days. Okay, one infant death every 3 days. If that doesn't compel someone into action, I don't know what will. But that was a piece of data that they were able to take and use, and they started their story of healthy futures, not funerals. Okay? That, again, was used to compel people into action. And so you want to make sure that people know what they should do as individuals or as groups. Now, normally what I would do is we would real quick go to exercise 3 and develop a message. Or framework. What I'd like to do is really quickly digress. Well, let me just say one thing and then we'll go into talking about social determinants. So with the messages, it's important that you connect your solution to the outcome. The desired outcome here in this case is improved birth outcomes. And what we're saying in this particular community, well, we know that women who have had poor birth outcomes, if we can get them into interconception care, that can help to improve birth outcomes. So connecting those two things is making sure there's the provision of quality and affordable interconception care, and that women know about it and they're able to access it. So again, when you look at the first box, it's got to relate to the second box. And this sounds very simple, but once you sit down and you fill out these kind of boxes, it really helps when you're trying. You don't get lost in developing the message if you're able to do this first. So I want to digress real quickly to talk about social determinants, because social determinants has now required us to come up with a new vocabulary, a new way of talking. Now that we start to look at the root causes of poor birth outcomes and all of these disparities, it requires a different vocabulary. And I've been doing social marketing forever, and I'm like, oh my God, I've got to come up with something new. So this is the WHO's definition of social determinants. Social determinants of health are the circumstances in which people are born, grow up, live, work, and age, as well as the systems put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces, such as economics, social policy, and politics. And I'm sure for most people who are in public health that we didn't think we're going to have to deal with all of this. To talk about reducing poverty, to talk about racism, to talk about stress. And so the traditional public health message may have been very simple: stay on a balanced diet with plenty of fruits and vegetables, exercise regularly. I mean, those were easy messages to put out there. And now we're charged with moving to the realities of social determinants. So that means that we're not only looking at behavior change from the individual, but we're looking at what changes need to occur within a community, within society. So now we're looking at issues of, well, you need to live near supermarkets that have affordable produce, fresh fruits and vegetables. So that's looking at built environment, that you're not having to take 2 buses to go and get healthy food. In terms of physical fitness, that you're living in environments that have maybe bike paths or walking paths or whatever. Sidewalks. Oh, even sidewalks. Right, even sidewalks. So for me, I've been doing social marketing for years and years, and this really challenges us. How do you now message in a way that isn't divisive? It isn't people blaming people, but it's how do we come together to change the conditions in which people live so that they all have an equal opportunity to be healthy. And that's what our charge is, and that's what our challenge is, and that's why I'm so happy with, well, let me just quickly share with you. This is kind of looking at the root causes. So again, if you're looking at addressing social inequities, in Wisconsin, we're looking at disparities in birth outcomes. So we're looking within the African American family, how do you strengthen African American families and communities? And then how do you increase access to health care, to quality health care? So if you look at some of this, you have reduced poverty, undue racism, father involvement, systems coordination. How do you talk about that? And I'm really excited about the work that Robert Wood Johnson Foundation has done. Are people familiar with a new way of talking about social determinants, about their research? Okay, you can Google it and actually get the whole report. But they have taken very complex concepts and tried to make them easy for anyone to understand across all political spectrums. Okay? So where we live, learn, work, and play impacts our health. I mean, you can be a conservative, you can be a liberal, everyone should be able to engage in that message. So I'm really pleased about the research that they've done. And basically what they came up with is that they said that in order to have a strong message that's going to resonate across the political perspective, it has to be value-driven. Driven by liberal values, conservative values, independent values. So the ideal of personal responsibility certainly will holds well with one particular end of the spectrum, but also giving everyone a chance to be healthy. Okay? So mix the values, make sure that people can relate to what the issue is that you're saying, that you're talking about. And again, this whole issue of providing solutions. Don't just talk about the problems. Give me some solutions. I'm going to hand this out, but they came up with 6 ways of talking about social determinants. And I would encourage you to start thinking about these. I've done exercises in rooms. I don't know anyone's political, where they are politically, but when you start asking questions and you have them move to different parts of the room, you can kind of understand where they are. When you start using their vocabulary, people start coming together, regardless of where they are on the political spectrum. So it does work. I don't have time to do that exercise, but it's amazing it works. So they came up with kind of 6 ways to talk, and I will pass that out and encourage you to use them. And so we clearly need a new vocabulary. We can't allow our vocabulary to impede our ability to influence change and to get our message across. So I shared with you some of these, but instead of talking about vulnerable populations, at-risk populations, which would be the traditional way, we can say too many Americans don't have the same opportunities to be healthy as others. I mean, even if you're in that group, if you're a part of the impacted population, if I'm impacted, I'd rather be over here called, well, I just don't have an opportunity to be healthy, without going into all the details. Instead of talking about health disparities, talk about giving everyone a chance to live a healthy life. Instead of talking about low-income workers and families whose dreams are being foreclosed. That's pretty powerful, I think. I think people can they can relate to that. Because people have struggled. Oh, I was a college student, I was this or that. People at some point in their life have struggled, and they can relate to these. So I'm challenging you to start adopting. It works. I have been in so many cocktail parties, whatever. Ooh, let me use this. It works. You can start having a conversation. These are words not to use, And I will say the ones that, my background, I actually worked as VP of Community Education for Planned Parenthood for a number of years. And this unjust, injustice, outrage, I mean, there's words up here that I used to use every day at Planned Parenthood. And these are the words that they're going to say, this is going to cut conversation right away. Avoid these words. Equal, equality, equalizing, leveling the playing field. I used to use that a lot too. So these are some words that their research is saying if you avoid these, you're likely to be able to continue to have the conversation that you need to have with people from across the spectrum. Okay? Finally, in talking about messaging, what makes for a strong message? It's a message that people can understand. Sometimes people like to be really witty, but just make sure people are going to understand it. That people can connect to the issue. I mentioned the example in Cincinnati, in Milwaukee. We look at the fact that in certain zip codes, we know that African-American infant is 3 times more likely than a white infant to die within its first year of life. So that's something that people can connect with. Credible sources involving the church are they viewed as being credible with the target population? We've seen it as being credible. Contagious. We want everyone talking about this. You want to create buzz around this. And you're able to do it using social media. You're able to do it by having people out in the community talking about the issue. And again, as I mentioned, delivering one compelling piece of data. And I know that we want to give people all the data, and then they're just kind of standing there. Just come up with one thing, one data point, and not only you use it, but everyone in your network is using that same data point. It goes back to my point about consistent message through multiple channels over an extended period of time. So if everyone's quoting that same statistic, it's getting out there and people are going to hear it. Some tactics. How do you promote your message? Social media, in terms of using the website, using Facebook, using texting. Texting really, that helps us a lot. We use texting all the time. Even if you send out an email blast to lots of people. Using your own social networks, as I mentioned, even people you don't know. If you're getting on the elevator, you want to create this buzz. You want to create this movement. In order for that to happen, you have to start talking about it. Goes back to those 4 C's. You have to make it contagious to others in your community. Get people to write, okay, thank you. Get people to write op-eds and letters to the editor. And people in your coalition who can write letters. Get on the radio, engage in digital storytelling, and then identify people in your community that can be ambassadors or street teams that are out talking up the message. I have an example in one of our campaigns, Journey of a Lifetime. When people saw those t-shirts right away, they knew they were talking about healthy birth outcomes. So just an investment in a t-shirt with your community folks. And then ultimately maybe implementing a social marketing campaign.